I just might go through a few points here and then we can bring people in again as needed. Just to thank again all of our witnesses for coming in and for your commitment, I suppose, and what you've given on the opening statements. You know, it is very important. It's actually quite a rich, it's great to hear how rich the initiatives are that are out there, you know, between the libraries, I suppose what's been done through Bernardo's, and I suppose, you know, look, it's just fantastic to see it, the fighting words, the creativity, and then also growing, you know, in the soil and so on, and what an impact that has to young people and to children. If I might just start with the Bernardo's side of things, if I might, Ms. Connolly, and just, you've highlighted that the reasons for a lot of the mental health challenges are, and you've stated in your opening statement, sort of parental mental health challenges, sometimes neglect, separation of the family unit, bereavement and parental addiction. So these seem to be the primary causes that you've indicated in your opening statement. And I think when you speak of the National Wellbeing Programme, you've spoken about it being rolled out to specific areas, say Dublin 15, Tallaght, Tip South, Limerick and Thurles. And I think roughly 500 children in schools. I was just going to ask you a little bit around that, like how long has that National Wellbeing Programme been going on? What are the constraints around it? And is there, I suppose, you know, it's great to reach those children, but we have so many, I suppose, in primary school and secondary school. So just maybe if you wanted to give a little comment on that. And also, I suppose, do teachers and parents participate too? I think in the opening statement you might have mentioned that. So maybe just to comment on that. And then just again, you spoke previously here in committee, I think on roots of empathy, or maybe it was in the mental health committee, I'm not sure which, but it was actually so impressive to hear about that programme. And I really think that that really does make a difference from what you've said in terms of how it engages with young people and children, and how actually the changes within themselves. Do you know, even though the activity is about showing it for others, it's about themselves as well. I might start with that, and then I'll bring in the others just with a few questions as well. Thank you.
Well, luckily the reason we were able to do the National Wellbeing Programme, again it's a proven programme, is because we were funded by the Late Late Show. That's how we were able to do it, and that's fantastic the way that we had that, and now we're fundraising for it. I think what I really like about that particular programme is because it engages the body, the heart and the mind, because a lot of the time a lot of talking therapies don't necessarily really connect children sufficiently into their body where things are manifested first. So I think that's really important. It also gives, as the little fifth class boy said, it gives them techniques and skills. And sometimes you can't change the circumstance that children are living in, but you can help them think about how can they self-soothe and do creative, positive things. And then ultimately what we try and do is do it for the parents as well. But that's why one of our recommendations is that whatever is given for children in the school context, you have to link it in to family support. And you have to also help it be accessible to families who are struggling. So I think it's key. It's back to what Niall was saying. It is that holistic approach and support is crucial. I think in terms of the Roots of Empathy programme, what we've been able to do, again, it's through fundraising. And one of the things, I think the tough thing this committee has is that I think the Department of Education is always reluctant to endorse any programme because of the funding commitments. And I think what needs to be given attention is something across the levels of need, prevention or intervention to the targeted level, and ideally that it is holistic. And so what we would say in Bernardo's is you, as much as possible, you have a holistic approach to children, their social, emotional, cognitive and physical needs. You ensure that a range of supports are provided depending on what's needed, and some children will need supports throughout their lives, and some families will, and some won't at all. But also I would really stress the importance of evidence-based.
Because I 100% behind you on that one. I think in order that there has to be an evidence base, I think, for any programme, and if we can show that, and I suppose that's where we're bringing in the academics into it as well, and as you say, the sort of the RC, like your randomised clinical trials and so on. It's crucial that we have that, because then it will drive policy, and we can drive it within our departments as well if we can show the benefits, the impacts. But in an evidence-based measure, in an evidence-based way. Thank you very much, Ms. Connolly. If I might bring in then, I know just around for Dr. Niall Muldoon, I'm aware that both Deputy or Chairperson here, Paul Keogh, and Senator Ronan Mullen actually visited with the committee, I think, to Dorset, and actually viewed that model. And I think currently a report has been written up on that, and I suppose will be given to us as well for information. But I suppose the information that you've provided, you've noted, I suppose, just the reduction of children coming off the CAMHS waiting lists. And I suppose that is the importance, as you've mentioned, I think, about realising perhaps that maybe that wasn't the place either for them to be, or that they needed early intervention supports. I suppose when we had the committee here last week, I believe it was, you know, we were hearing as well about all the different supports that are available in terms of online interventions in school, you know, the Smarter Moves programme, or, you know, having access to sort of online supports, and even that was like, say, the text line number 50808, and just how important that is as well for early intervention. But I suppose maybe if you might just comment, I suppose it's crucial that we have, you know, sort of that involvement of both the Department of Health and the Department of Education around these types of programmes, but also that it will be effective in bringing children off that waiting list, but also that they're getting the early intervention they need. Is there any other elements that you would think in terms of early intervention that would be beneficial here as well?
Yeah, well, I mean, I think the other thing to note is that they said they took 1,000 young people off the waiting list for CAMS, but that's not the only number of children they dealt with. So they also would have dealt with a lot of people who weren't on CAMS. So there's a lot of work being done as well, children who'd be their first intervention. So it's recognising that there's a bigger number being dealt with. But early interventions, I mean, there's early interventions all around me here. You know, school library, fighting words, growing, Bernardo's, all those, they're all in early interventions. They're the ones that, again, create that stronger child, that more confident child. Yeah. Or even just that child who's now willing to say to some adult that I'm afraid, or I need a bit of help, or I need something extra. So I think our education system is starting to see that, and they're starting to move in that holistic way, and that social emotional learning. They recognise now, and you can hear it constantly at conferences that I go to, that they know the child cannot become educated until they're socially and emotionally safe. Yeah. And that's what they need. And the teachers need that from around the children. And many schools have done that on their own bat. So we need the education system to support that change. But I think that's where the education system is now ahead of the Department of Health. They're now saying we need to engage in all of our parts of our children's lives to provide for the better service and better education in the most rounded way. And I think that's where we need to start moving away from the silos that have been created up to now.
Yeah, and I suppose build on perhaps that pilot, I know that will be delivered hopefully through the Department of Education in terms of the funding that's rolled out.